Hi, Bob Quinn here for Blue Poppy. We had a request from some of the local acupuncture students to show what a whole hour or nearly an hour of Sotai would look like. So I'll do that. We have a patient here. I'll do a little assessment before we get him on the table. The complaint is some upper body tension. For me, I studied Sotai for 3 years, and even still at that point, I had no idea what a whole treatment of Sotai would look like. I had really learned it as add 5 minutes of this or 10 minutes of this on at the end of your acupuncture session. What the whole hour would have looked like, I couldn't really conceive it. And then in October 2003, I met Peter Thompson in Connecticut, received treatment from him, changed my life. And I went on to study with him, stayed in touch with him, going back there every year, and still in touch with him. And for him, Sotai is his main therapy. It's the acupuncture that's added on for 5 or 10 minutes. And that was a real revelation for me. So I'll give you a sense here of what an entire Sotai treatment might look like, and I hope you get some good ideas from it. So we'll go to the patient now. I'll put on my mask. So hands at your side. So we see a twist this way in the shoulder girdle. I'm checking SCM tension, and down here the scalenes point. Both sides very tight. This side actually tighter. Shoulder, maybe the left shoulder a little bit lower. I'm going to just load a little bit pressure here. And when I do, my attention all comes to this upper left quadrant. And I'm going to come down to the hips, also load, same thing, my attention is pulled over here. Again, I'm just loading. How much pressure? Maybe 50 grams, very light. You don't need much. You just want to notice where is your attention pulled. And then on the hips, we'll see. It seems like maybe the right ASIS is a bit anterior. And checking the legs, tighter gallbladder channel, right leg. Yin compartment on the right leg, lower leg, much tighter. Okay, so we've got those ideas. Let's have you up on the table, face up. Oh, head the other way, sorry. So we can continue with this idea of some assessment. And this leg, you probably notice, a lot more effort on my part required to get it to roll in. This one easier. All right, I'm gonna see, what about the weight? This one is, to my perception, considerably heavier in my hands. You'll see that comes into play in a little bit. What about checking some channels, much tighter, stomach 37 area. More deficient feeling here now. And then I'm going to push up through a straight leg. I want to see what happens in the pelvis when I do that. Tight on both sides, but better movement here than there. Maybe you could see that. Just check a forearm. We don't have time to go through this, but I always do the forearm diagnosis. What mainly comes up is liver finding. Liver in Chinese medicine thinking. And a secondary finding of lung, right? The surface has a little bit of a lung feel. Lung pulse is indeed a bit weak. Liver, very weak. So we start there. It's okay to check abdomen. Same. So we've got cold below umbilical plane. Not cold. Really, it's cold up to maybe Ren 9. A little bit of lung weakness, and then, yeah, this weak liver. So, and the spleen also a little weak. Makes me go back and check. As I guess I find that. So I have a little bit of a baseline assessment. You'll see I continue to assess as I go through. In Sotai, when time allows, if you're going to do a whole treatment, you have to start down here. Right? We call these the root movements up above, the flower movements. And so we can start. Now in Sotai, I like to work on both legs at the same time. That's the key part of Yin Sotai. You'll see there are other videos up on YouTube that give the Yin Sotai idea. Here I try to show pretty standard Sotai. So in Sotai we need the direction of ease. Clearly coming in is not ease. Clearly rolling out has more ease. Same here, hard to come in, easy to go out. So direction of ease means with the exhale, then you're going to roll gently out like this. At some point, and you'll be exhaling the whole time. And when you encounter my resistance, nothing at all changes for you. Keep exhaling, keep trying to move until I say the magic word, relax. Instantly let go of your effort then. Okay, so breath in. Exhale, mindful, gentle movement out. Keep going, keep exhaling. Relax. So you notice he's doing active movement. I have resistance. After I say relax, then it's passive movement. I take him through the rest of the range of motion. Hopefully you noticed that I resisted for 2 or 3 seconds. That's about what my teacher Peter does. In Hashimoto's book, he says 3 to 5 seconds of resistance. So each move I want some variation. By the way, I already feel a difference in the movement. So here, well, how can we create variation? Well, I can change the position. I could be out here. That would be a change. Or I could just say, use half as much muscle at this time as last time. Breath in. Exhale. And I can resist. I'm earlier on resisting than relax. So many ways of bringing in this idea of a variation. Resist at different points, require a different amount of muscular effort from the patient. I'm already warming up here. Change the positioning of the patient's body. So we'll just do 2 of that. You can do even 3, but I'll just show 2. So when I'm here and I'm pushing this way very subtly, it's easier to do it here. I interpret it this way. Direction of ease on this side is to, in fact, do that because it moves that way, relatively speaking, more easily than this side. This side, I'm going to get the opposite move to. So we start this one up here, this one here, and then this is your movement, okay? Gentle, mindful with the exhale. Breath in, exhale. That's it. Keep coming, even though I'm resisting. Relax. Wonderful. I already see it change, but we can do that again. Half the effort. Breath in. Exhale. Keep coming. Relax. And passively completing. Interesting. The legs are both much lighter already than when we started. There are hundreds, literally, of Sotai moves possible. I'm just going to show moves that are high frequency moves. I'm comparing. There's moving to patient's left, patient's right. It feels tighter coming this way. Is that your perception? Yeah. Patient says yes. So if it's tighter coming this way, that can't be the direction of ease. It's got to be that way. So I'll start over here. Where? Anywhere that's comfortable. Breath in, moving left, exhale. I've got the weight of the legs in my hands. Relax. And then passively completing it. You want to make sure that with that move, the patient is not holding the weight of their legs up. Okay, give them to me. Breath in, go on left, exhale. Keep going. Relax. Passively complete. Now you can see that I'm resisting separately on both sides, but of course at the same moment. So these legs are already feeling quite a bit more loosey-goosey, more the mobility is much better. Check here. So when I check, this leg actually goes up more than that. So that one doesn't like up. It has to like something. So it's going to like coming out of the pelvis. So with the exhale, then you're going to come long through your heel into my belly. Gentle, mindful, exhale. I'm resisting by leaning my weight in, relax. And you saw there the passive completion was just a little bit of suggesting length. Now on this side, I can do the opposite. I can play the leg out, and then the movement is to bring it back up into the pelvis. Okay, breath in, gentle, mindful, exhale. Relax, good. Oh, much better movement. Okay. I'm feeling for the quality of movement. This one actually better now. This one does a better job of going up. He's tighter back here, and I feel that tension engage. So I'm comparing which one of these does a better job of going up. It's this. And so this one has to go down. Lots of ways of doing. I could do them, of course, one at a time. And you're welcome to do that. What I like to do, though, is always have one side working against the other. Why is that? When you do that, the core pelvic stabilizing muscles, we call koshi, they all have to be employed. They have to be utilized. And we want that. That's a key Sotai principle. Always involve koshi. Koshi literally means hip, but we take it here to mean kind of the greater lumbopelvic center. So this is what I like to do, is this one is going to be coming down, bend. At the same time, I'm going to resist here. This one you're going to try to lift, very, very light effort, but I'm not even going to let you off the table, right? So it'll look like this. This will be coming down. This one gets pinned here. Okay. So breath in. Exhale, up, down. It's like a scissors movement. Relax. Now what he gave me, in fact, was much more effort than I wanted here. Not that it's hard for me, it's easy. But just not even a half, not even a third that much muscle. Okay. This one I'll start up farther. That's a difference. Breath in, out, down here. Relax. Moving much better. check here. I don't want to hyperextend. It's a very light touch. I'm wondering which side does a better job of moving back towards the table. Is this side. So down is okay here. Well, I don't want to start here if I'm going down because that would be hyperextending. But I'm going to let this one go down, same time this one comes up. Let's just go back. How did I get that? I put weight here. How much weight? A little bit more than gravity. And this one would give a little bit. That tells me it has an available movement down. So I give it down. This one I do the opposite. I always want them playing off if I can work it out that way. Okay, so up, down. Breath in, gentle, mindful movement. Keep coming, even though I'm resisting. Up over here, relax. Yeah, switch now. Now this one, better to go down. So it's worth always reassessing if you have time. So breath in, this going down, this up. Exhale. Relax. Wonderful. Now we often will stop and have a little bit of linkage. What happens, so I'm doing this rocking. This I learned in the Traeger massage system. My teacher, Peter, he'll do a little shiatsu at this point. I choose to do this. I do use shiatsu, I love it. I do it at the end, more on the back. So I can do it standing at the side of the table. I can also get under, one leg under, so my knee under their knee. My knee is above their knee. My inside hand comes through all the way to this side. It generates a rock. This hand joins in. And I've written an article in the North American Journal about how Sotai is yin-yang manual medicine. Even here in the linkage, we see yin-yang. And that I'm not just rocking this way, this way, this way, that would be fine. But I feed it up in, shortening the muscles, that's yin. And then lengthening, that's yang. So in fact, our earliest mention of yin-yang in the literature, according to Heiner Fruhoff, who's one of our best classical scholars, is expansion, that's yang, yin is contraction. This feels like a different gallbladder channel, of course, than what I first assessed. So here's yin. And if you listen, kind of listen to the tissue, you'll know when it's when it's the right moment to offer yang. It's not like a pendulum, yin, yang. No, you have to listen. In general, we do more yin than yang with this move. Now here I am, I can do Sotai right here. It's clear that rolling out is easier. Comparing this to that, that is the direction of ease. So with the exhale bend, just bring your knee out to the side. Gentle, mindful, breath in. Exhale. Keep coming. Relax. And I'll just show that one, but of course you can do that 2-3 times, no problem. And I like how the leg, the movement is feeling. So again, why are we doing this linkage? Well, I'm about to hop up and bring the feet onto the table and do moves up here. So I've worked down there for a bit. I'm going to come up here. And it's a good time for the nervous system to try to integrate the changes that came about from the Sotai movements we've done so far. In Sotai, we're after the nervous system. And in this rocking, we're not after the muscles, we're after the nervous system. That's our target. And with the hands, I want to communicate safety, confidence, competence, compassion. Right, this is very different. In shiatsu, I learned this kind of rocking. Feels great, but that's not what I'm after right here. And I want these hands. See, my hands are not squeezing. I'm not massaging. The movement is the medicine here. And I'm paying attention to improvements in the quality of the movement. If you're not comfortable and getting up on the table like this with your one leg, that's fine. I already showed you how to do it standing at the side, but I'll just say to the patient, I'm going to lift your leg, get my leg under it to do a little rocking. Is that okay with you? No one's ever said no, but it's a polite thing to do, professionally to ask. And if you're not comfortable again, this can be done standing. And so here again, inside hand comes under. There's yin, 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 yang, yang, yin. So with the exhale, clearly on this side, direction of ease, like there, is out. A breath in, exhale, relax. Passively then completing it. Okay. Just out of curiosity, let's check in with our assessments. There's still a weight difference. This is still heavier, but much better. And I hope you can see the movement is so much more pleasant. And a radically different finding here now. Now I can find the spleen a bit more clearly and liver improved. Checking here. Very different here in the lung. There's still a little something. Much, much better. Still a little something. Lung pulse still a little weak. A big improvement in the liver pulse. Big improvement. Okay, let's have you bring your both legs up, feet together. Now I'm just going to ask you to take them first one side, then the other, and tell me where it's more comfortable.
To the left.
Okay. So where do I start? Anywhere over here, but it's still pretty easy here. So as the knees come to me, right, this is the direction of ease, we're going to use that. I can resist separately like this, or as they're coming to me like this, I can use this hand here instead of here, and I can push them together so that the resistance here will go through and apply to this leg as well. Either way works. So breath in, exhale, gentle, mindful movement towards me. Keep coming. Relax. Now, I'm of the school of thought that when I say relax, I want the muscles to actually relax before I then passively complete the range of motion. Some people don't go that way in Sotai. As soon as they say relax, they quickly finish. So you might see that in some other Sotai videos. I'm not fond of that myself. I want the actual relaxation in a muscular sense to occur before I then passively complete it. So I won't go as far this time, so that'll be variation, and I'll ask for less muscular effort. Breath in, exhale, come my way. And I'm going to let it come a little farther than I did last time. That's variation. I'm resisting both. Relax. And passively complete. You see, I'm not in a big hurry to do this passive completion. Okay, leave this one there. I'm going to take this knee to the chest. And, okay, come here. Let me move it up. Notice how comfortable or not comfortable. It feels like there's a little hitch in here in the movement. Okay, so you notice that. And here, this one goes up. But which of those has a greater sense of ease going up? Yeah, that would have been my guess. So what are we going to do? This one will go up because, relatively speaking, it has a direction of ease that way. This one then would be the opposite way. Now I can do them both. I could get up on the table, but I'll show you what it looks like separately. So with the exhale, so see how I'm cupping here. So this is where resistance comes, and here is just a stabilizing hand. And you'll see at the end that I shift this under. So when I say relax and he lets go, I want it to really be relaxed here in the inguinal area as I bring the leg down. Breath in. Exhale, gentle, mindful. That's it. Keep lengthening. I'm resisting now. Relax. Make sure he's not helping me. And down it goes. So I'm going to start up a little farther. Breath in. Less effort. Exhale. Keep coming. I'm resisting a little earlier. That's variation. Relax. And make sure he's really relaxed. And then play it out for the rest of the way. And now, lots of variations on this. You can, of course, check out here. And like in Thai massage, you can be resisting above your ASIS. It would look like this. Breath in. Exhale. Well, this would be an example of variation. I'm resisting just by holding my position. Relax. And then bring it out. And that would be another way of getting some variation. So this one was going long, this one's going up. So I won't start absolutely flat like this. I'm going to bump behind the knee a little like this. The breath in, the knee goes up, mindful, gentle, keep going, keep going. You see my resistance is here. Relax. And just make sure it really is relaxed. And there it goes. Okay, breath in. Exhale, less effort, keep going. Still mindful. Keep going, even if it's slow. Relax. Oh, I'm going to have to charge $150 for this pen. Yes. I get some much better movement. Let's go check. ASIS. So you don't have to do something this dramatic, but if you do, I'm not saying that's wrong, but I'm saying you can get the same information more subtly. And that different level of touch communicates something to the patient. So meeting it with a weight that's a little bit more than gravity. And this side will go down more than this. I mean, on this side, the direction of ease is down. Here would be up. So this bony prominence is going up. This side is going down. I'll resist on both sides. Breath in. Exhale. Down on the right, up on the left. Relax. Cool, got a big change. Now, let's see, is that still the same? Still the same. Up. Up. When I say up here, I mean this relative to this. This wants to go up, this still wants to go up. So with the exhale, this happens, and this happens, okay? Breath in. Exhale. Relax. Good. We'll say down and down. Exhale. Down with the knee. Relax. And again, gonna check, I'm just curious. This liver pulse. Much, much better. I'm showing you some of my favorite moves. Here would be movement in a different plane, pushing the ribs this way easier, towards this side. Meaning I want him to shift his ribs this way, right? I'm checking. Is it easier to do this or this? So this was easier to me. So with the exhale, ribs shift this way gently. Relax. Even one was really good. So we'll do that again. At the same time, this comes up. Again, I want to work across the body if I can, either same level or different levels, different joints, because it's impossible to move here and here without activating Koshi. We want the lumbopelvic muscle activation. So this goes up to the ceiling, this slides out to the camera. Breath in, gentle though, mindful. Relax. Pretty good. Sotai, after 20 years now, it still surprises me. So a little bit more than gravity. This one does not want to go down. So we give it up. So this goes up to the ceiling, this goes down to the table. Breath in. Exhale. Relax. Oh, that made a big difference. So maybe they both can go up. Let's check here. So this one for sure is still up. Now I'm going to have this go up now and this go up. So I'm continually reassessing. Breath in. Exhale. Relax. I'm still going to have this one go up. And this one down. Relax. Good. So that's one plane, but of course we've got this too, so I'll have to come up here and sit down for a moment. See, I'm taking a whole body approach if you haven't picked up on that. The complaint is upper back muscular tension. I didn't just work on the upper back. I haven't done anything there much other than this torso work is likely helpful to some degree there. But we've got one body, it's all connected. Working in the ankles helps everything up here. So here I'm just playing with some movement. I want to know what's going on in the neck. So I see C6 kind of tight, C4, C5 kind of tight. Okay, check here. So here, a little bit of impulse down. In this case, both of them are relatively unhappy going down, so we can have both are going to slide up as if to touch shoulder to ear. So let's start down here. Breath in. Exhale, gentle, mindful. Relax. And back down, less muscle this time. Breath in. Exhale, both sliding up. I'm resisting now. Relax. So now we see a difference. This one has an easier time going down, so now we can switch. I did two with both of them coming up, but now this one reveals itself as having an easier time going down. So I'll start it up here, so it has some down available to it. And this one, will do the opposite, so it looks like this is what we're going to do. Where am I going to resist here? Well, that wouldn't help to put my hand here, but I can grab here. I can come under in the armpit also. I'll just work with the arm here, and I'll resist here. Breath in. Exhale. Up on the right. Relax. Now that was more muscle than I really wanted, so we'll just fine-tune the instructions and say less than half of that much muscle. Breath in. Exhale. Of course, shoulders strong. Relax. Good. And then in the neck, doing those shoulder moves helped the neck quite a bit. Okay, and checking, what does it feel like when I roll to the left, roll to the right? They're pretty close. Where does it seem more at ease to you, Ben?
To the right.
To the right. Breath in. Exhale, gently rolling rightward. Relax. So you see I'm resisting here above the ear, and this is a stabilizing hand over here. And then we passively complete it. I can feel kind of stuck here. That would be, I could just leave them alone for 5 minutes with a needle there. That would be fine. Or I could use a tation, do some tapping and pressing. We'll do that again. Breath in. Less muscle this time. Relax. It's very good, by the way, for your patient to learn how to finesse their nervous system to get significantly less effort and still have it be smooth and continuous. Okay, so with the exhale, bring your head back. Exhale. Relax. That one I do without testing. It's generally always going to be back that way. And then we're checking lateral flexion. Don't help me though. I think you have better movement to this side. Yeah, okay. Breath in. Exhale. Relax. With this one, notice that my hands stay under his head, and I'm helping a little bit, because as he goes this way, the inclination is to bring rotation in. And I just want lateral flexion. So I kind of help them along a little bit. It's the frictional drag on the sheet that's going to invite in that unwanted rotation. Okay, breath in. Exhale. Relax. Of course, in the arms and shoulders, there are many moves. We'll just look at a few. In that same way that I was rocking on the leg as a linkage function, that's what I'm doing here. I'm going to recheck this C6, I'd say about halfway improved. C4, C5, C4, more improved than C5. I just noticed. Of course, I could come in and just do needles there. I could wait and turn over and do jaji line in the neck as possible. Okay, so here are some real basic ones. We're comparing moving down, moving up. Where's your direction of ease?
Down.
Down. Okay. So I don't want to resist here. That'll stress the elbow. So I stabilize here. I'll resist here. So breath in. Exhale. Keep coming. Relax. Across or back?
Back.
Okay. Breath in. Exhale. I'm just showing you one of each. Relax. In a treatment, if you had time, you would probably do at least two. Here's more of that rocking kind of linkage work. You'll see if the arm has really relaxed by the response that they have to this kind of rocking. See, there you see yang. I'm offering length. Length is expansion, is yang. And that can come in here also. Just let it relax. Okay, so here, if I start them up here, of course it's going to be easier to go down than to go up farther. Well, the inclination is, if they're going down, is to accomplish it all with the muscles right here. I want a broader response to that, though. So I'm going to touch back here, kind of the muscles very close to the spine. Say, I want you first to use muscles here. And only later, when I say the word shoulder, do you get to use these. Okay, relax here, though. Let me get you up in starting position. Okay, breath in. Exhale. Shoulder. Relax. And that would be done more than once, but in the interest of time, I'll keep it to the once. Of course, in the arms, because the shoulder is so complicated, there are many, many moves. Here's a different rocking move. Many moves available in Sotai. You can have supination offered, and so on. So with this, I can feel in the back where it's tight. I already have a good sense of my curiosity. Remember when I did my initial assessment, I felt in the upper left there were some issues drawing my perception there. Okay, we'll just do those on this side. Then I'll show you a little bit face down. Okay, again, checking. There's what up feels like. Down. Up. Down. Down seems easier?
Yes.
Yeah. You would think that's always the case. It's true 80% of the time. But sometimes for people, going up is easier. Don't let me do the work. Okay. Breath in. Exhale. Remember, we're resisting above the elbow. Relax. Good. Comparing across, back, back. Okay. Breath in. Exhale. Relax. Good. Yep. Let me have it. Same thing over here. Starting with muscles back there first. Breath in. Wait, let me lift you. You don't push your arm up. Okay. Good. No. Breath in. Exhale, going down. Now the shoulder muscles. Relax. Exhale. So, I'll check abdomen from this side. I'm curious about the liver. So much better. So much better. Everything. It's amazing. You know, I found this. You don't get these kinds of changes just doing any old, say, kind of massage. That it's something. I think it's Sotai's use of the breath. Well, that's what Peter Thompson feels. It explains why it works so much better to balance out disharmony in the pulse and so on. So I think this all feels wonderful. So we'll take a moment to get turned over here. I'll be right back with you. So often in the Sotai, well, Sotai is often done on a shiatsu mat on the floor. So of course you're on the same level with the patient, but I'll show what that would look like here. I'm getting up on the table. And you can see that the patient's right heel goes in much, much closer to the buttocks. Of course, I could bully the side and get it up there, but it's clearly not happy with that. So let's interpret that. Direction of ease here, relatively speaking, is going to be towards the buttock. So we'll start it here, so it has somewhere to go. And we end up with this scissoring motion. Starting here, and this is the movement. You always have to figure in Sotai, well, how am I going to resist? Well, this one is going in, the resistance has to be here at the Achilles. If this one's coming this way, it's going to be here, like it's stomach 41. Okay, breath in, exhale, relax. See the difference? Almost the same now. Still feel a bit different. Breath in, exhale, relax. Very close. I'm going to bring the knees together. Use my knees, keep the patient knees together. I'm going to go this way. Oh, that's tight. It's so easier moving to the patient left, starting here, then going this way. Breath in, exhale, relax. Maybe you noticed the engagement here. That's what we want. Breath in, exhale, relax. Excellent. There's left, right, left, right. Which is happier, easier.
I think left.
I think so too. Breath in. Exhale. Relax. Of course, we could do it differently. We could say, clearly this one going in is better because it's hard to go out. Hard to go out. So we can start them both out and let them come in. That's also Sotai. Breath in. Exhale. Feet come together. Keep coming. Keep coming. Relax. We'll do that again. Breath in. Exhale. Relax. Excellent. A little bit stronger rocking there. Okay. Now if you're not wanting to get up on the table, you could just do it one leg at a time, like this. That's fine. You won't get as dramatic an engagement of koshi, the pelvic stabilizing muscles. So you could do just some gentle rocking like this. You could be assessing the back shu points while you do it. Feels very dull here, energetically dull. Probably T6, maybe, yeah, T6. And a little bit here, more spleen stomach level. This side also. What we did face up, we can do here. I can check. Much easier for me to lift here. So this side doesn't like up, must like down. Breath in. Exhale. I have my finger on the ASIS. Relax. I can combine that. Is it still the same? Yeah, still the same. I can come across. Well, I say both really want to go down. This one more so. Well, we'll see. I'll say this one can come up, and this one still down. So this comes up to the ceiling. This goes down to the table. Breath in. Exhale. Make the connection across your back. Relax. So for sure down. So this is going to roll up and this going down. Connect through your back, the two areas. Keep coming up. Relax. Excellent. You can get here, and the ones coming up and down could still be done. No problem. Many more moves could be shown, but I think that gives a good idea of a doable, fairly simple routine. Let's have you turn back over. I want to see what the neck feels like, pulse, forearm, the weight of the legs, all that stuff. I'll start with how does the neck feel. Oh, the price of this treatment just went up. And there's still something, I don't know, maybe C3 or 4. That feels better. Better. That's much, much better. Wow. Okay, my friend. Thank you for volunteering your body for the advancement of medical science.
You're welcome.
I hope this is helpful to you all. Give some idea how it looks to start low down at the feet, move through the body, always looking for the direction of ease in a movement, giving the patient that direction of ease. We're talking about relative ease between left and right comparisons. And then let them go. At a certain point, you'll offer 100% resistance. There's always a confusion. I'm tracking along. This is 0, 0, 0 resistance, then 100. I'm just here so that I'm in position to offer what I want to. So, just the last point, because some people always have the question, well, where do I resist? Well, if you're doing 3 repetitions, you could say the first one is resisted early on. The second one comes a little deeper into the range of motion. And the third one, deeper still. That's certainly an option because it's always variation. I prefer, like Star Wars, trust the Force, Luke. This idea that you can feel in the patient's movement when is that aha moment when they will ideally meet your resistance. Play with that. It is a perception we can develop in ourselves. There. There, right? So that's where I hope you go. And whatever you want a protocol to start with, just start by first time resist fairly early, next one a bit farther in, next one farther in still. And remember to vary the amount of effort you're asking the patient to give. In general, we get it lighter and lighter effort. We don't build up the effort. We want to get subtler. You can see I don't like talking with this mask, a little bit difficult. And do take the time to do some assessments ahead of the treatment so you have a sense, well, what did that Sotai accomplish? Obviously, the joints are moving smoother, more balanced left to right. But you might not have the perception as a beginner to really pick up those kinds of cues. But if you're an acupuncturist and you're used to assessing the pulse, I think you'll be quite surprised at the end of the Sotai treatment how much has changed. Okay, thank you so much. Thank you.